But now let's send it on over to Kurt and Elena.
Thank you, Taizo. UHA encourages family and friends to ask some tough questions because it can save a life.
Manolo joins us now with a health expert on suicide prevention in today's Catching the Wave to Better Health.
Well, it's a difficult subject to talk about, but needs to be discussed. Very important. Here with Howard Lee, the UHA President and CEO, and Marya, the Executive Director of Mental Health America. Good morning to you. Mental Health America of Hawaii.
Thank you.
Okay. Howard, let's start with you first. Obviously, you know, it's a problem out there that families need to deal with. What do you want to say about it?
Yeah, at UHA, we wanted to talk about this issue because we're a big believer in prevention as a way of improving people's lives as well as saving lives. So we wanted to talk about the subject of teen bullying, teen suicide, because we think that's an issue that's important to talk about. It's rising here in Hawaii. Teens are especially vulnerable. You know, they're younger, they don't know where to go, unlike adults. So we thought bringing this issue to light would be very important.
Okay. And Marya, what does Mental Health America of Hawaii would like to tell everybody about it?
Well, the sad part is we're the land of aloha and sun and shine and surfing, but we have a lot of desperate kids, a lot of depressed kids, and we have the highest rate in the nation of kids who have made a plan to kill themselves, an actual plan to kill themselves. And suicide is the leading cause of death of young people, age 15 to 24. So a lot of sad kids.
We're not only dealing, I mean, we were all familiar with bullying as teens, but now there's cyberbullying, which is, of course, you know, certainly a lot harder to prevent. What can people do?
Well, there's several things you can do. So cyberbullying is when somebody sends a very nasty message or a picture or photo about somebody and it spreads all over, throughout the school, throughout everywhere. So the person's anonymous. So for the victim, they don't know who's doing this, and they think everybody knows about it. So it's a horrible situation to be in. And kids who are cyberbullied have 3 times the rate of suicide attempts. So what can we do? If you're a victim or if you're a parent, save everything. Save every photo, every text message, every nasty thing, and take it to somebody. If you're a kid, take it to a trusted adult. If you're a parent, take it to the school authorities. You can even take it to the police. And if you're a friend, you can do something. Number 1, you can tell the bully to stop. Number 2, don't send the messages any further. Don't gossip. And you can counteract the negative message by saying nice things about the person, by spreading, you know, virally good things, positive things about the person.
As a friend or a parent, and if they see somebody who feels, you know, really being bullied and probably thinking about suicide, are there signs, or what should they do if they think somebody is at getting close to that stage?
The most important thing is to ask the question. So if you think somebody may be depressed, if they're acting, you know, like they could be depressed, and there are many signs, you know, weight loss, sleeping problems, poor grades, you know, appearance deteriorating, anger. There are many signs, and you can go to our website to find out more. But you ask the question, you say, are you thinking about killing yourself? It's not going to make the person do it. It's not something we're comfortable doing, but if you don't know, you can't help them.
Sometimes you have to ask a difficult question.
You have to ask a difficult question.
The website is?
mentalhealth-hi.org.
Okay. Thank you very much for that.
Thank you.
We'll be right back.